Hi everyone, I'm very excited that you are looking at this presentation because that means that you're interested in neurology. I'm Tiffany. I'm a fourth year medical student at UW, and hopefully this presentation helps you figure out a bit about if neurology might be right for you, what your options are within neurology, and also how you can get there. So this is an overview of what I'll be talking about. So first describing exactly what it is that neurologists do, why I picked neurology, specifics about neuro, what kind of electives you should take, the timeline for deadlines and requirements that are pertinent to the specialty, tips for letters of rec, how to be competitive, the different fellowship opportunities, and then lastly, some helpful resources. So first of all, the scope of practice for neurology. So the main thing is that neurologists diagnose and treat neurologic disease. There's a lot more that we can do for treatment nowadays than in the past in the field of neurology, and that's something that you'll discover when you do your neuro clerkship. But an important thing to keep in mind too is that it is both an inpatient and outpatient specialty. However, in your future career, if you want to be more of an inpatient versus outpatient physician, then you can kind of guide your career in either direction. So on the inpatient side, you'll be seeing a lot of things like stroke, MS exacerbations, status epilepticus, etc., versus outpatient is more like chronic neurologic diseases. So dementia, Parkinson's, again, MS applies. A lot of people don't know this, but neurology involves some procedures as well. It's not just a diagnostic specialty. So neurologists, depending upon where you work, perform LPs, EEG, which is electroencephalography, is a procedure that neurologists are trained to do. So we don't actually put the leads on the patient's head, but you interpret the electrical recording from the patient, and that's your job. Then also EMG, so electromyography, so you are basically interpreting the muscle electrical recording. And then, of course, Botox, which can be for headaches, dystonia, lots of different things. Obviously neurologists can work both in the community, they can also work in academics. Keep in mind that if you are an academic, so as with all their specialties, you're kind of expected to do a lot of research. And another thing to remember too is that in smaller towns, you're often the first line for pediatric neurology care as well, because pediatric neurologists are just so few in number that quite often, like if a patient's presenting to the ED with meningitis and they're, an 11-year-old or a 12-year-old, you're going to be the first one to treat them. And if it's something that's really complicated out of your scope, you can refer to a pediatric neurologist, but that's something to keep in mind if you're interested in working in smaller areas. So I put up that image of the brain MRI as well as a reminder that neurologists are also responsible for interpreting our own images most of the time. So especially in like acute stroke care, you need to know right away before the radiologist has a time to interpret the image if the patient has a stroke or not and what kind of stroke. So it's actually really cool in that like you get to have a lot of radiology training, probably more than any other specialty aside from radiology. So the reasons why I picked it. So I loved the diagnostic process in neurology. I absolutely just loved lesion localization. And I just thought the patients were super cool too. I think that in neurology, like the bread and butter are basically the zebras that like you learn in your preclinical. So a lot of the like common diseases for neurologists are really cool, interesting things. I also just fell in love with the neurology exam. And I loved how our exam in neurology provides us with such detailed information And it really is like kind of the last field of medicine where we rely on the exam more than we do on imaging findings, more than we do on, things like ancillary testing. Like the exam is such a crucial component for us. And then I really loved talking to patients and having patient relationships. I liked the idea of being able to have long-term relationships with my patients too. And so there was that aspect. I found that I really wasn't a huge fan during my primary care rotations of doing like well visits and things that were like more of bread and butter for primary care. Like hypertension, diabetes just bored me to to no end, versus like pathophysiology of stroke I found way more cool. And so I figured, hey, I probably shouldn't do, because I was originally kind of thinking of doing internal medicine. And I was like, yeah, maybe I shouldn't do it if the bread and butter is just not all that interesting to me. And I also did really like the idea of being able to interpret my own images without relying on a radiologist. And then the diagnostic procedure side is super cool. I think it's very awesome that with EEG and EMG, you can like electrically right in front of you see the pathophysiology of the patient play out. So it's really cool. And then the fact that with neuro is kind of a field where there's so many new things we can do for patients and new treatments that are constantly being discovered. It's kind of like the last frontier of medicine in many ways, and that there's still so much more that we're learning. So that's really cool. And another great thing about neuro is that it is a super high in demand specialty. Like it's the #1 in demand specialty in the country actually right now. So it is really easy to find a job. You can work anywhere, live anywhere you want to. And that's the really cool thing about it too. So it's a 4-year residency. So you do 1 year of IM and then it's 3 years of neuro-specific training. Most end up doing a fellowship after residency. And that's kind of like, yeah, the vast majority, I would say, do fellowship after residency. Often this is because, like, even if you do want to do general neurology, it can be good to have a certain area of expertise depending upon the group you're joining. Like, they've already got a movement guy and a cognitive guy, but they would love to have, a like epileptologist join the team or whatever. So that sort of thing, and then also just to get some billable procedures. So for neurology, you end up doing the regular NRMP match process, but kind of a nuance to keep in mind is that some neuro programs are categorical, which means that they include all 4 years of training, but others are advanced. So it's just 3 years of neuro training, which means that you have to apply to that 1 year of prelim medicine training separately, and you need to interview for those programs separately from your neuro programs. That's something to keep in mind. So average salary is really variable. A lot of this depends upon where you are. Just like other fields of medicine, you get paid more in rural areas versus cities, and then you get paid less in academics versus community practice. That's kind of, standard for all, pretty much all specialties actually, and then procedures offer you higher reimbursement. And the average salary, though, is $267,000 a year, according to the last Medscape review. It seems like it's on an upward trajectory overall, though. But a good thing, too, is that you have a lot of negotiating power going into neurology because there are so few neurologists that they're like a lot more willing to negotiate with you on salary, which is great. So the average week is also super variable. Depends on your specialty, depends where you're working, etc. And the kind of two general models is that you'll either do like neurohospitalist work, so maybe you have done a vascular fellowship or an epileptology fellowship, and so they kind of tend to follow a 7 on, 7 off, or some sort of variation of that classic hospitalist schedule. But Versus if you want to do outpatient neuro, you could easily end up with a 8 to 5 type of job. However, I've seen a lot of different models too. Like I've worked with a neurologist who wanted to do both hospitalist and outpatient. So he would do like a week of hospitalist, and then he would do like a week off, and then he would do like a week of outpatient. Or some people also have a model where they're, rounding on patients in the morning, and then they have like clinic in the afternoon, and they take call once in a while. So it totally just depends on the group, the hospital, where you're working. So electives that are required for for neurology. So you need to have your general neurology rotation done. That's like a definite. However, like the rest of the electives that you need in order to apply, you don't really need anything else. But it would be great just to show that you're interested in neurology by taking other electives that might be pertinent. Like I took child neurology, epileptology, and PM&R and radiology prior to submitting my ERAS. At UW, my med school, we also have a neurocritical care elective option. But I'm sure that this is also like med school specific, and there's probably other options at other med schools, but those are just the ones that we have at UW. And as for AWAYS, so this is something that's really not all that necessary to do. Neurology is not that competitive of a specialty, and especially if you're coming from a good school and are, a decent applicant, you don't really have any red flags or anything, you really don't need to do an AWAY. The one instance for this would be if there's like one program that you're like, I really need to go to this program for whatever reason that you have about wanting to go to that program. But in that case, it could be a good idea to do an AWAY. However, keep in mind that like AWAYs can hurt you just as much as they can help you. I actually, after talking to my advisor, because I kind of had like one program I was thinking of, and after talking to my advisor, we decided that because I had like done well in my gen neuro rotation already, or got honors or whatever, it actually would maybe have more of a chance of hurting me by trying to do in a way than helping me. So if like perhaps you didn't honor your gen neuro rotation, maybe that would be an instance where you might try to prove yourself more on an AWAY in gen neuro. But also keep in mind, like even if you are in this scenario where you have like one program that you're thinking about like more highly than other programs, that your mind could easily change. Mine did when I got on the interview season. I no longer was thinking about that program I originally was. So yeah. Anyway. All right, the general timeline. So in your preclinical years, if you can get involved in any neurology specific research projects, that's great. The psychiatry and neurology interest group, we have that here at UW, and that neuro interest group might look different at other schools. But getting involved with that's a great idea. Try to do as well as you can on step one. Neuro is not super competitive, but I would at least aim for the national average if you can. And then just like any way that you can try to stand out or demonstrate your interest in neurology. So I didn't know that I wanted to do neurology when I was a preclinical student. But something that I did talk about a lot in my interviews was all my volunteering, because that's something that's super important to me, and I had done a lot of in both preclinical and clinical. And so like, just find your passion and try to have something interesting about yourself, I guess, that you can talk about in interviews, even if it's not neuro related. In third year, try to do well in your clerkships, of course, get as many honors as you can. I think if you had to pick one third-year clerkship that you should really try to honor, that would be internal medicine, because, becoming a future neurologist, you still have to do that 1 year of IM, and they want to see that you're pretty competent, or you can be competent in IM too. So this is also the time when you try to find some letter writers. So it's always, I think, great to get an IM letter. You have to have an IM letter if you're applying to any prelim programs, but I think also just, IM and neuro are pretty similar. If you can get a letter from IM, great. If not, that's also okay. You can just think about whoever you had a good relationship with, or in whatever rotations you might have gotten honors in, etc. This is also the time when you're trying to decide your 4th year schedule, so make sure you plan to do Gen Neuro early so you can get the grade for that, figure out if this is really what you want to do. And then, of course, you take step 2 after your 3rd year as well. Just try to do, again, at least national average if you can. 4th year, so you're doing your Gen Neuro clerkship early on. Obviously, do your best in this because you definitely want to get a letter from a neurologist that you've worked with. So really good idea to just try to knock that out of the park and try to take whatever neuro-related electives you can. This is also a time when you need to really start looking into what programs you might be interested in and figuring out what factors are important for you for residency because you submit ERAS in September. And then as for deciding too, like how many programs you're going to apply to, this is something that's really student specific. I would recommend just talking to your neurology advisor about it. I think that there can be a really big range depending upon your individual factors, such as, if you happened to fail any steps or fail any clerkships, or, maybe you don't have any of those red flags, but you didn't get all that many honors, or there's a lot of, individual factors that go into it, but I would say that, you will end up spending a whole lot less money than your friends who are doing more competitive programs. I would say most people don't really apply to more than 30 neurology programs. So just to have that number in mind. So then interview season starts. So for neurology, this is October through January. Most of yours will be in October and November, primarily. Some neuro programs also offer second look days. So that's something to keep in mind. So January and February, maybe try to take some clerkships for which that you can take a couple of days off. That way, in the event you want to go to one of those second looks, you can. And then, of course, you submit your rank list at the end of February. So a thing to keep in mind, though, with the whole interview season process, so prelims. So if you're in the boat where you've applied to some neurology programs that are advanced, keep in mind that prelims are really competitive. So you probably want to apply to, the number of prelims you want to apply to depends on how many of your programs that you're applying to for neuro are advanced, of course. But a good general rule is apply to double the number of prelims for the number of advanced programs you're doing. It seems like a lot, but it's actually necessary because they're super competitive. Anesthesia competing for prelim, there's radiology, derm, so like everybody wants a prelim spot. So they interview mostly in December too. Just keep that in mind when you're deciding, when you're like planning out all your neuro interviews, which will come in first. You should really try to make sure you're pushing them toward October and November because the prelims will come later for you. So letters of rec, there you don't really need a neuro chair letter. That's not necessary. Most residency programs will want at least 3 letters. However, their website will give you the exact details on if you can submit more than 3, usually no more than 4, however. So of course you're going to want a letter from your Gen Neuro clerkship. I would say, as I already mentioned, it's a good idea to have one from IM as well. And then your other 2 letters can be from research experience, it can be from one of your neuro-related clerkships, or any other clerkship where you had a good relationship with your instructor. So then for the whole prelim thing, so for prelim programs, they do want an IM share letter, so you'll need to figure that out with your IM department. And then they also, it's a good idea to have a letter from IM too for prelims because, they're a medicine program. And And then I would say just like submitting your gen neuro letter is probably good too, just to show them that, yeah, like you are, a neurology applicant, and I guess to provide further focus on that. So how to be competitive for neurology. So hooray, you're applying to a non-competitive specialty. The vast majority of US MDs and DOs are not going to have a hard time matching. So you can give a sigh of relief. Your process will not be as stressful as many of your colleagues' process. However, there's a couple key things to keep in mind, nevertheless. Demonstrating interest in neuro is really a key thing. So neuro programs are accustomed to people dual applying neuro and PM&R, or dual applying like neuro and neurosurge even. There's a lot of like scenarios where, because neuro is not quite as competitive, people are dual applying. So you really just want to show them that you are interested in neurology in particular. Neuro is kind of a research-heavy field overall. There's a lot of new research in neurology, so I think it's pretty attractive to them if you can have at least one publication. The other thing is it's a good idea to perform well in both IM and neuro, as I already said, and show an upward trajectory if you can in terms of your grades during your clinical years. Like I already mentioned, just try to aim for the national averages on your STEP exams. Maybe consider, in a way, if your heart's really set on a program. And then during your interviews, really be able to speak eloquently about why neurology. I think this was asked of me on almost every single one of my interviews. They all want to know why you're picking your specialty. So yeah, make sure you have some great reasons for that. So fellowship opportunities. Most fellowships in neurology last 1 to 2 years. I'll get into some of the variations in a little bit, but so it's pretty like almost completely necessary to be fellowship trained if you're considering a career in academics in neurology. It's not necessary for community neurology, but as I already mentioned, can be a good idea if you want to have some billable skills, like you want some training in clinical neurophys. You can do EMG and EEG and bill for that. If you want to have a certain area of expertise, like maybe you really like, neuromuscular patients, and so like you want to see neuromuscular patients a little bit more, then like you'll have that area of expertise. So it can be a good idea. And so some common fellowships, just everything that I have on that list there, everything from movement disorders to epilepsy to headache, neurocritical care, sleep medicine. So those are some of the like really common things to pursue, really common fields in neurology. However, there's also some less common fellowships that you can go into. I cannot say that all of these are going to be guaranteed to be 1 to 2 years. In particular, the neuroradiology and neuropathology routes, because those fields are kind of owned by the radiology and pathology departments respectively. For those fields, it's because you didn't go through like radiology or pathology residency, those fellowships are going to be longer than 1 to 2 years. Pretty certain. I don't know exactly the exact number, but something to look into. But I think that like if you take a look at the less common list, it really highlights just a huge amount of diversity in neurology, and that was like the other reason I picked it. Like really the only thing you have to know before you decide you want to do neurology residency is, hey, I like the brain. Because literally, if you end up deciding, oh, I'd rather be more of a diagnostic provider rather than a clinician, just go ahead and do a neuroradiology or neuropathology fellowship. Or if you're like, oh, actually, I kind of want to be more of a proceduralist than a clinician, you can do a neurointerventional fellowship. If you decide like, oh, I'm actually like kind of want to be more on the like psych/procedural side, do pain medicine. If you're like, wait, I actually wanted to work with kids, not adults, and and I want to work in a city where I won't be seeing or there are like pediatric neurologists, so I won't be seeing kids. Then you can go ahead and actually do a pediatric epilepsy fellowship straight from an adult neuro residency. And I think that one is still only 2 years. So really, like, the world is completely open for you in terms of like what you decide you like best in terms of procedures or diagnosis or whatever. So just huge variety. So these are just some helpful resources for you all in case you like have more questions or want to learn more about the field. So obviously the American Academy of Neurology, FRIDA is a pretty good residency program database. You can get a lot of great info on different residency programs. Same thing with Doximity. I use that quite a bit too, and there's some reviews as well posted by residents. I mean, who knows how many of them are like, doctored by the program directors and whatnot. So can't really rely completely on those, but it's a resource nonetheless. And then also the NRMP residency match data. So this is basically a tool to give you an idea for like based on like certain parameters like step score, like research number of publications, etc., like how the average applicant in your field fits in terms of those numbers. So pretty good resource. Here at UW, we have Dr. Eric Kraus as our neurology advisor. He's also the neuro clerkship director, and he's just a wealth of knowledge, great resource as well. So if you decide that you'd like to talk to me too, you can always reach out. I would love to hear from you guys. I'm very, very excited that you're pursuing neurology. So of course I would be overjoyed to help out in whatever way I can. Thank you for your time.